Question 1. Topic: Infection control and safety protocols. A phlebotomist accidentally experiences a needle stick injury while drawing blood from a patient with a known blood-borne pathogen. What is the first immediate action the phlebotomist should take? A. Report the incident to the supervisor before washing the wound. B. Wash the affected area with soap and water immediately. C. Squeeze the wound forcefully to remove potential pathogens. D. Apply antiseptic and bandage the wound without reporting it. Answer: B. Wash the affected area with soap and water immediately. Explanation: the Occupational Safety and Health Administration (OSHA) and Centers for Disease Control and Prevention (CDC) guidelines state that in the event of a needle stick injury, the first step is to wash the affected area with soap and water. This helps reduce potential contamination. Reporting the incident, option A, is important but should follow immediate first aid procedures. Squeezing the wound, option C, is discouraged as it may cause deeper tissue injury and increase pathogen spread. Applying antiseptic and bandaging, option D, should be done after washing, but failure to report the incident violates workplace safety protocols. The exposed individual should also undergo post-exposure prophylaxis (PEP) evaluation based on the type of exposure and patient status. Question 2. Topic: Venipuncture techniques and procedures. During venipuncture, a phlebotomist inserts the needle at the correct angle and observes a flash of blood in the hub, but no blood flows into the tube. What is the most appropriate corrective action? A. Remove the needle and reattempt in a different site. B. Pull the needle back slightly and adjust the angle. C. Keep the needle in place and increase the tourniquet pressure. D. Forcefully push the needle further into the vein. Answer: B. Pull the needle back slightly and adjust the angle. Explanation: when a flash of blood is seen in the hub but blood does not enter the tube, it indicates the needle may have gone too far into the vein or is against the vein wall. Slightly withdrawing the needle and adjusting the angle, option B, can help re-establish proper blood flow. Removing the needle completely, option A, should be a last resort as excessive reattempts increase the risk of hematoma formation and patient discomfort. Increasing tourniquet pressure, option C, is not a recommended corrective action once the needle is in place, as prolonged tourniquet use may cause hemoconcentration. Advancing the needle further, option D, risks perforating the vein, leading to infiltration or hematoma formation. According to CLSI Clinical and Laboratory Standards Institute guidelines, adjusting the needle's position is the recommended first step before considering another attempt. Question 3. Scenario-based. Topic: Patient interaction and communication skills. Mrs. Thompson, a 75-year-old patient with a history of difficult venous access and anxiety about blood draws, is scheduled for a routine blood test. She expresses nervousness and mentions previous painful experiences. How should the phlebotomist best handle this situation? A. Reassure Mrs. Thompson with a calm voice, apply a warm compress to the site, and select a smaller gauge needle for better comfort. B. Ignore her concerns and proceed quickly with the draw to minimize her stress. C. Tell her that pain is unavoidable but promise to be as fast as possible. D. Ask a colleague to perform the draw instead to avoid complications. Answer: A. Reassure Mrs. Thompson with a calm voice, apply a warm compress to the site, and select a smaller gauge needle for better comfort. Explanation: patient-centered care is essential in phlebotomy. Communicating with empathy and reassurance, option A, helps alleviate anxiety and improves patient cooperation. A warm compress enhances vein visibility, reducing the risk of multiple attempts. Using a smaller gauge needle, a G20 grams, can minimize discomfort. Ignoring concerns, option B, or dismissing pain as inevitable, option C, damages patient trust and violates ethical care standards. Asking a colleague, option D, should only be done if the phlebotomist is inexperienced with difficult draws, but it is not the primary approach. According to HIPAA and patient rights regulations, medical professionals must provide compassionate care while ensuring patient safety and comfort. Question 4. Topic: Special phlebotomy procedures and tests. The patient is scheduled for a glucose tolerance test, GTT, to assess possible diabetes mellitus. The phlebotomist collects a fasting blood sample before instructing the patient to drink a glucose solution. Afterward, blood samples must be drawn at specific intervals. What is the most critical consideration when performing this procedure? A. Ensuring the patient drinks the glucose solution within 5 minutes and does not eat or drink anything else during the test period. B. Allowing the patient to leave the facility after drinking the glucose solution and return at the scheduled time for the next blood draw. C. Performing all blood draws from the same vein to ensure consistency in glucose readings. D. Using a different type of anticoagulant tube for each blood draw to compare respective. Answer A. Ensuring the patient drinks the glucose solution within 5 minutes and does not eat or drink anything else during the test period. Explanation: the glucose tolerance test (GTT) requires strict adherence to protocol. The patient must consume the glucose solution within 5 minutes to ensure a consistent starting point for glucose metabolism. Any deviation, such as eating, drinking, or excessive movement, can lead to inaccurate results. Option A. Allowing the patient to leave. Option B is not recommended because physical activity can affect glucose metabolism, leading to false readings. Performing all blood draws from the same vein. Option C is not necessary and may lead to vein damage or complications like hematoma. Blood should be drawn from accessible sites while following any puncture techniques. Using different types of anticoagulant tubes. Option D is incorrect because glucose levels must be measured consistently using the same type of tube, typically a grey top sodium fluoride tube. The Clinical and Laboratory Standards Institute (CLSI) guidelines emphasize maintaining proper patient preparation and adherence to timed collections for accurate diagnostic results. Question 5. Topic: Phlebotomy complications and emergency situations. A phlebotomist is performing a routine venipuncture when the patient suddenly becomes pale, sweaty, and unresponsive. The patient is exhibiting signs of a vasovagal reaction. What should the phlebotomist do first? A. Immediately remove the needle, lower the patient's head, and elevate their legs. B. Continue the blood draw while reassuring the patient that the reaction is temporary. C. Call for emergency medical assistance and continue applying pressure to the puncture site. D. Administer oxygen and prepare Rome elution for hydration. Answer A. Immediately remove the needle, lower the patient's head, and elevate their legs. Explanation: vasovagal reaction occurs when patient experiences sudden drop in heart rate and blood pressure, leading to fainting. The correct response is to immediately remove the needle to prevent injury. Option A. Then lower the patient's head and elevate their legs to promote blood flow to the brain. Continuing the blood draw. Option B is dangerous as the patient unresponsive and at risk of falling. Calling for emergency assistance. Option C may be necessary if the patient does not recover quickly, but it is not the first step. Administering oxygen and preparing Roman fluids. Option D is outside the scope of practice for phlebotomists unless they are working under direct medical supervision. OSHA and CLSI guidelines stress the importance of patient safety, monitoring for signs of distress, and ensuring proper positioning to manage vasovagal reactions effectively. Question 6. Scenario-based. Topic: specimen processing and handling. Mr. Alvarez is a phlebotomist working in a hospital laboratory. He receives a blood sample from the emergency department labeled for a legal toxicology test. Upon inspecting the sample, he notices that the chain of custody form is incomplete and the specimen is missing a tamper-proof seal. What is the most appropriate action for Mr. Alvarez to take? A. Reject the sample and request a properly documented recollection. B. Complete the missing chain of custody information himself and process the sample. C. Process the sample as usual but make a note about the missing documentation. D. Ignore the issue since toxicology tests do not require chain of custody protocols. Answer A. Reject the sample and request a properly documented recollection. Explanation: chain of custody protocols are crucial for forensic and legal toxicology tests to ensure sample integrity and prevent tampering. If a sample is received without proper documentation or tamper-proof security measures, the correct action is to reject the specimen and request a new, properly documented collection. Option A. Completing the document himself. Option B would be falsifying records, which is illegal and unethical. Processing the sample with missing documentation. Option C would compromise the validity of the results, making them inadmissible in legal proceedings. Toxicology tests requiring chain of custody protocols. Option D include drug screenings, alcohol testing, and forensic analyzers, all of which must meet strict regulatory requirements under clear standards. Question 7. Topic: quality control and laboratory standards. Which of the following best describes an essential aspect of quality control QC? A phlebotomy laboratory. A. Running control samples and documenting results before patient samples are tested. B. Performing patient venipunctures faster to increase efficiency. C. Allowing laboratory personnel to create their own documentation methods without standardization. D. Storing specimens at any temperature as long as they are tested within 24 hours. Answer A. Running control samples and documenting results before patient samples are tested. Explanation. Quality control QC ensures the accuracy and reliability of laboratory test results. Running control samples before testing patient samples. Option A helps verify that laboratory equipment and reagents are functioning correctly. Performing venipunctures faster. Option B does not contribute to quality control and may increase it or patient discomfort. Allowing personnel to create their own documentation methods. Option C leads to inconsistencies and violates clear regulations which require standardized record keeping. Specimen storage conditions. Option D must adhere to specific temperature and stability guidelines, as improper storage can lead to inaccurate test results. Adhering to QC protocols helps ensure compliance with regulatory standards and patient safety. Question 8. Topic: Venipuncture techniques and procedures. During a routine venipuncture, the phlebotomist accidentally punctures an artery instead of a vein. What is the correct response? A. Apply direct pressure for at least 5 minutes and notify the supervisor. B. Immediately remove the needle and continue the blood draw at a different site. C. Ask the patient to apply pressure while proceeding with other collections. D. Ignore the arterial puncture and document it as a successful venipuncture. Answer. A. Apply direct pressure for at least 5 minutes and notify the supervisor. Explanation. Accidental arterial puncture requires immediate and proper management to prevent excessive bleeding or complications. Applying direct pressure for at least 5 minutes. Option A helps control bleeding and the phlebotomist must notify their supervisor. Removing the needle and proceeding at another site. Option B ignores patient safety concerns, could cause additional harm. Asking the patient to apply pressure. Option C is inappropriate, as healthcare personnel should ensure proper hemostasis. Ignoring the issue and failing to document the arterial puncture. Option D is unethical and violates laboratory safety protocols. The CLSA guidelines recommend monitoring the patient and ensuring proper post-procedure care in case of arterial puncture. Question 9. Topic: Legal and ethical aspects of phlebotomy. A phlebotomist is asked to collect a blood sample from a patient who refuses the procedure despite being informed of its medical necessity. What should the phlebotomist do? A. Respect the patient's decision, document the refusal, and notify the healthcare provider. B. Proceed with the blood draw despite the patient's refusal to avoid delaying treatment. C. Convince the patient by emphasizing that refusal could result in severe health consequences. D. Have colleague hold the patient's arm while collecting the blood sample to ensure compliance. Answer. A. Respect the patient's decision, document that refusal, and notify the healthcare provider. Explanation. Patients have the right to refuse medical procedures, including blood draws. The phlebotomist must respect the patient's autonomy, document that refusal, and inform the healthcare provider. Option A. Proceeding against the patient's wishes. Option B violates informed consent laws. Pressuring the patient. Option C is unethical and could lead to legal repercussions. Using force. Option D constitutes battery and could result in legal action. HIPAA and informed consent regulations emphasize patient rights, ensuring that all medical procedures are performed with voluntary consent. Question 10. Topic: Patient identification and safety. A phlebotomist is about to collect a blood sample from a patient in the emergency department who is unconscious and has no identification. The nurse informs the phlebotomist that the patient was brought in without any personal belongings or ID. What is the best course of action for the phlebotomist to ensure proper identification of the sample? A. Assign a temporary ID number and ensure all samples and documentation match this ID. B. Collect the blood sample and write John Doe on the specimen label until the patient is identified. C. Proceed with the blood draw and have the nurse write the patient's name when it is determined. D. Refuse to collect the sample until the patient's identity is confirmed. Answer. A. Assign a temporary ID number and ensure all samples and documentation match this ID. Explanation. In emergency situations, when a patient cannot provide their identity, hospitals use a unique temporary ID number to ensure proper patient identification. Option A, writing John Doe. Option B is inappropriate because multiple unidentified patients may be present, leading to potential misidentification. Collect sample without proper labeling. Option C violates patient safety protocols. Refusing to draw blood. Option D is not an option in an emergency where testing could be critical for diagnosis and treatment. Proper identification procedures follow hospital policies and the Clinical and Laboratory Standards Institute (CLSI) guidelines to maintain accuracy and prevent errors. Question 11. Topic: Order of draw and tube selection. A phlebotomist is drawing multiple blood samples for a patient undergoing various diagnostic tests. The laboratory order includes a blood culture coagulation studies and a complete blood count (CBC). In what order should the phlebotomist collect the tubes? A. Coagulation tube, light blue, blood culture, sterile bottle, then CBC, lavender. B. Blood culture, sterile bottle, coagulation tube, light blue, then CBC, lavender. C. CBC, lavender, blood culture, sterile bottle, then coagulation tube, light blue. D. Blood culture, sterile bottle, CBC, lavender, then coagulation tube, light blue. Answer: B. Blood culture, sterile bottle, coagulation tube, light blue, then CBC, lavender. Explanation: the correct order of draw follows the LSI guidelines to prevent contamination and ensure accurate test results. Blood culture tubes, option B, are collected first to avoid contamination from additives in other tubes. The coagulation tube, light blue, follows because clotting factors can be affected by contamination from other additives. CBC tube, lavender ether, is drawn last because ether can affect coagulation. Studies if drawn first using the wrong order, options A, C, or D, can cause cross-contamination and affect test results. Question 12. Topic: Pediatric phlebotomy considerations. A phlebotomist is performing a venipuncture on a 3-year-old child. The child is crying and moving their arms, making it difficult to proceed. What is the best approach to ensure a successful and safe blood draw? A. Ask a parent or caregiver to hold the child securely while explaining the procedure. B. Proceed immediately and restrain the child forcefully to prevent movement. C. Distract the child with a toy or video while performing the venipuncture without assistance. D. Delay the procedure until the child stops crying and becomes completely still. Answer: A. Ask a parent or caregiver to hold the child securely while explaining the procedure. Explanation: pediatric phlebotomy requires a calm and controlled environment. Asking a caregiver to assist in holding the child, option A, provides comfort and safety. Restraining forcefully, option B, can cause distress and potential injury. Distractions, option C, may help but are not a substitute for proper restraint. Delaying indefinitely, option D, is impractical since young children may not stop crying. Proper positioning and communication help ensure a smooth procedure while minimizing trauma. Question 13. Topic: Bloodborne pathogen safety. A phlebotomist accidentally sustains a needle stick injury while drawing blood from a patient with a known history of hepatitis B. What is the first step the phlebotomist should take? A. Wash the site immediately with soap and water. B. Squeeze the wound to expel any blood and then bandage it. C. Continue working and report the incident at the end of the shift. D. Apply alcohol to the site and continue the blood draw. Answer: A. Wash the site immediately with soap and water. Explanation: the first step after a needle stick injury is to wash the site with soap and water, option A, to reduce exposure risk. Squeezing the wound, option B, is not recommended as it can increase tissue damage. Delaying the report, option C, is unsafe and violates OSHA guidelines. Applying alcohol, option D, is not sufficient. The phlebotomist should follow up with an immediate report and possible post-exposure prophylaxis as per CDC guidelines. Question 14. Topic: Specimen rejection criteria. A phlebotomist receives a call from the lab stating that a patient's potassium test results are critically high. Upon reviewing the sample, the phlebotomist notices that the specimen was collected in tube with excessive shaking. What is the most likely cause of the abnormal result? A. Hemolysis due to improper handling. B. Clot formation from underfilling the tube. C. Contamination from using an expired tube. D. Normal fluctuation in potassium levels. Answer: A. Hemolysis due to improper handling. Explanation: excessive shaking causes hemolysis, option A, which releases intracellular potassium into the plasma, leading to falsely elevated results. Underfilling, option B, may affect some tests but does not directly cause high potassium. Expired tubes, option C, could compromise test validity but not in this manner. Potassium levels, option D, do fluctuate, but extreme results warrant sample review. CSI guidelines emphasize gentle inversion of tubes to prevent hemolysis. Question 15. Topic: Capillary blood collection. Which situation would require a capillary blood sample instead of venipuncture? A. A patient undergoing chemotherapy with fragile veins. B. A patient requiring multiple blood cultures. C. A patient with severe dehydration needing electrolyte testing. D. A patient requiring large volume blood testing. Answer A. A patient undergoing chemotherapy with fragile veins. Explanation: capillary samples are useful for patients with difficult venous access, such as chemotherapy patients. Option A. Blood cultures. Option B. Require venipuncture. Severe dehydration. Option C. May yield inaccurate capillary results. Large volume testing. Option D. Is unsuitable for capillary collection due to insufficient sample quantity. Question 16. Topic: glucose monitoring and point-of-care testing. What is the primary reason for wiping away the first drop of blood when performing a fingerstick glucose test? A. To remove tissue fluid that may affect results. B. To decrease the risk of bleeding. C. To collect a smaller sample size. D. To increase the rate of blood flow. Answer A. To remove tissue fluid that may affect results. Explanation: the first drop of blood contains interstitial fluid, which can dilute glucose readings. Option A. Removing it ensures accuracy. It does not decrease bleeding risk. Option B. Affect sample size. Option C. Or increase blood flow. Option D. CLSA guidelines recommend using a clean gauze pad to wipe the first drop before collecting the sample. Question 17. Topic: transporting and storing specimens. Which of the following specimens must be transported on ice to maintain stability? A. Lactic acid. B. Bilirubin. C. Blood culture. EC. Answer A. Lactic acid. Explanation: lactic acid, option A, degrades at room temperature and must be transported on ice. Bilirubin, option B, is light sensitive but does not require ice. Blood cultures, option C, must be kept at body temperature. A, option D, should be stored at room temperature. Question 18. Topic: blood culture collection and contamination prevention. A phlebotomist is collecting blood culture specimens from a patient suspected of having a bloodstream infection. The patient is nervous and asks why multiple bottles are needed. How should the phlebotomist respond? A. We collect multiple samples to increase the chances of detecting any bacteria or fungi in your blood. B. One bottle is for testing bacteria, while the other is for viruses. C. Each bottle contains a different anticoagulant, so we need both to get accurate results. D. The more blood we collect, the better the chances of curing your infection. Answer A. We collect multiple samples to increase the chances of detecting any bacteria or fungi in your blood. Explanation: blood cultures require multiple bottles to improve detection of microorganisms. Option A. Bottles typically contain different media, aerobic and anaerobic, to support various bacteria and fungi. Viruses, option B, are not typically tested using blood cultures. Blood culture bottles do not contain anticoag. Option C. Collecting excess blood, option D, does not enhance treatment. Proper site preparation and collection techniques minimize contamination risks. Question 19. Topic: tourniquet application and hemoconcentration prevention. A phlebotomist applies a tourniquet to a patient's arm for venipuncture. Due to difficulty locating a vein, the tourniquet remains in place for over 2 minutes. How can this affect the test results? A. It can cause hemoconcentration, leading to falsely elevated analyte levels. B. It increases blood flow, making it easier to collect a sample. C. It prevents contamination by keeping blood stagnant. D. It only affects platelet counts, not other laboratory results. Answer A. It can cause hemoconcentration, leading to falsely elevated analyte levels. Explanation: prolonged tourniquet application causes hemoconcentration, option A, leading to artificially high levels of proteins, enzymes, and electrolytes. Tourniquets restrict venous return, option B, not increase blood flow. Stagnation increases contamination risk, option C. Hemoconcentration affects various analytes, not just platelets. The CLSI recommends removing the tourniquet if it has been in place for more than 1 minute. Question 20. Topic: specimen handling for light-sensitive tests. A phlebotomist is collecting a bilirubin test from a newborn. Which of the following is the correct way to handle the specimen? A. Place the specimen in a light-resistant container or wrap it in foil. B. Immediately place the sample in a freezer. C. Transport the sample in a heated container. D. Allow the sample to sit at room temperature for an hour before testing. Answer A. Place the specimen in a light-resistant container or wrap it in foil. Explanation: bilirubin is light-sensitive and breaks down when exposed to light. Option A. Freezing. Option B can cause cell lysis. Heat. Option C can degrade the sample. Delayed testing at room temperature. Option D may lead to inaccurate results. Proper handling ensures accurate bilirubin measurement in neonatal jaundice diagnosis. Question 21. Topic: venipuncture site selection in special populations. A phlebotomist needs to collect a blood sample from a patient with a history of double mastectomy. What is the best site for venipuncture? A. The dorsal hand veins. B. The antecubital vein on either arm. C. The median cubital vein on the least affected side. D. The wrist veins near the radial artery. Answer: A. The dorsal hand veins. Explanation: patients with a double mastectomy may have compromised lymphatic drainage, increasing the risk of lymphedema. Hand veins, option A, are preferred. Using the antecubital area, options B and C, risks complications. Wrist veins, option D, are not ideal due to their proximity to nerves and arteries. Question 22. Topic: coagulation testing and tube inversion. A phlebotomist collects a light blue coagulation tube for a prothrombin time (PT) test but forgets to invert it after collection. How can this impact the test results? A. The sample may clot, leading to inaccurate results. B. The test will still be valid as long as the sample is processed quickly. C. The results will only be affected if the sample is not centrifuged. D. The omission has no effect on coagulation testing. Answer: A. The sample may clot, leading to inaccurate results. Explanation: light blue tubes contain sodium citrate, an anticoagulant that must be mixed by inversion, option A, to prevent clotting. Inverting ensures even distribution. Rapid processing, option B, cannot correct clot formation. Centrifugation, option C, does not reverse clotting. Question 23. Topic: specimen transport and temperature requirements. A phlebotomist is transporting an arterial blood gas specimen to the laboratory. What is the appropriate handling method? A. Place the specimen on ice and transport it immediately. B. Transport the sample at room temperature within 1 hour. C. Store the sample in a warm environment before transport. D. Delay transport until multiple specimens are ready. Correct answer: A. Place the specimen on ice and transport it immediately. Explanation: bug samples, option A, must be kept cold to prevent gas exchange changes. Room temperature transport, option B, can alter results. Warm storage, option C, increases metabolic activity, affecting oxygen and carbon dioxide levels. Delayed transport, option D, compromises accuracy. Question 24. Topic: hemolysis and incorrect needle gauge selection. A phlebotomist uses a 25-gauge needle to collect a blood sample from an adult patient. What is the primary concern with using this needle size? A. Increased risk of hemolysis due to small needle diameter. B. Inadequate blood flow leading to an incomplete draw. C. Pain at the puncture site. D. Difficulty inserting the needle into the vein. Answer: A. Increased risk of hemolysis due to small needle diameter. Explanation: small gauge needles, option A, can rupture red blood cells, causing hemolysis. Incomplete draws, option B, are less common but possible. Pain, option C, and difficulty, option D, depend on technique. Larger needles, 2-1, 2-3 gauge, are preferred for routine venipuncture. Question 25. Topic: identifying and resolving hematoma formation. A patient complains of pain and swelling at the venipuncture site immediately after the blood draw. What should the phlebotomist do? A. Apply pressure and a cold compress to reduce swelling. B. Continue the blood draw to complete the sample collection. C. Ignore the symptoms if the blood flow was normal. D. Apply heat to the site to prevent clot formation. Answer: A. Apply pressure and a cold compress to reduce swelling. Explanation: a hematoma, option A, forms due to blood leaking into tissues. Applying pressure and a cold compress minimizes swelling. Continuing the draw, option B, can worsen the issue. Ignoring symptoms, option C, risks complications. Heat, option D, may increase bleeding. Question 26. Topic: HIPAA and patient privacy in phlebotomy. A phlebotomist is drawing blood in a shared hospital room. The patient asks for details about their lab tests. How should the phlebotomist respond? A. Provide the information but ensure other patients cannot hear. B. Decline to share details, citing hospital policy. C. Share test details freely since the patient has the right to know. D. Refer the patient to their physician for results. Answer: D. Refer the patient to their physician for results. Explanation: HIPAA regulations require that patient results be communicated through appropriate channels. Option D. Providing details, option A, may violate privacy. Declining outright, option B, is unhelpful. Sharing information, option C, in an open setting breaches confidentiality. Question 27. Topic: order of draw and contamination prevention. A phlebotomist is collecting blood samples for multiple tests including a complete blood count, CB, a prothrombin time, PT, and a blood culture. What is the correct order of draw to prevent contamination? A, light blue, PT, lavender, CBC, then blood culture. B, blood culture, light blue, PT, then lavender, CBC. C, light blue, PT, blood culture, then lavender, EBC. D, lavender, CBC, light blue, PT, then blood culture. Answer B, blood culture, light blue, PT, then lavender, CBC. Explanation: the correct order of draw follows the CLSR guidelines. Blood cultures are drawn first. Option B, to prevent contamination with anticoagulants. Coagulation tubes light blue follow, then enter tubes lavender for CBC. Drawing blood cultures later. Options A, C, D risks contamination. Question 20. Topic: patient identification and specimen labeling. A phlebotomist enters a patient's hospital room to collect blood sample. The patient is unconscious and has no family members present. The phlebotomist notices two patient ID bands on the wrist with slightly different names. What should the phlebotomist do next? A, use the ID band that matches the requisition form and proceed with the draw. B, ask nurse to verify the correct patient identity before drawing blood. C, choose the ID band that appears newer and proceed with collection. D, draw the sample and label it with both names to ensure accuracy. Answer B, ask a nurse to verify the correct patient identity before drawing blood. Explanation: patient misidentification can lead to serious medical errors. The phlebotomist must verify identity with a healthcare provider. Option B, using an ID band without confirmation. Option A is risky. Choosing the newer band. Option C is unreliable. Labeling with multiple names. Option D creates confusion. Question 29. Topic: preventing hemolysis during collection. A phlebotomist is collecting a potassium test from a patient using a syringe method. After drawing the blood, they notice some resistance when transferring the sample into the tube. What should they do to minimize hemolysis? A, gently push the blood into the tube using slow, controlled pressure. B, forcefully expel the blood to ensure a quick transfer. C, shake the tube vigorously to mix the anticoagulant immediately. D, use a smaller needle to reduce pressure during transfer. Answer A, gently push the blood into the tube using slow, controlled pressure. Explanation: excessive force during syringe transfer. Option B causes hemolysis, leading to inaccurate potassium results. Vigorous shaking. Option C also increases hemolysis risk. Using a smaller needle. Option D increases resistance, worsening the issue. Controlled transfer. Option A preserves cell integrity. Question 30. Topic: special considerations for geriatric patients. A phlebotomist is performing venipuncture on an elderly patient with fragile veins. Which technique is most appropriate to prevent complications? A, use a smaller gauge needle and butterfly set for a more controlled draw. B, apply a tourniquet tightly for an extended time to help locate a vein. C, collect blood from the wrist veins to avoid bruising. D, use a syringe and forcefully aspirate to quickly obtain the sample. Answer A, use a smaller gauge needle and butterfly set for a more controlled draw. Explanation: fragile veins require a delicate approach. A butterfly needle. Option A allows for controlled blood flow, reducing vein collapse risk. Extended tourniquet application. Option B increases hemoconcentration. Wrist veins. Option C are prone to complications. Forceful aspiration. Option D damages fragile veins.